Hello everyone, my name is Mercy Agbeye. I have a bachelor's degree in linguistics from the University of Ibadan, Nigeria, and a master's degree in clinical linguistics from the University of Groningen here in the Netherlands. And today I'll be the facilitator presenting the last topic for the week. And today I'll be talking on picture exchange communication system for children with autism spectrum disorder. And before I proceed, I would like to explain some short forms of some terms. For the picture exchange communication system, I will be using PECS for short, and for autism spectrum disorder, I'll be using ASD for short as from now on. The PECS is basically an evidence-based intervention that is designed to help children with autism to develop their functional communication skills. And PCS is specifically beneficial and advisable for children who are nonverbal or children who have limited speech capabilities. And a brief history about the PCS, because of course we know to everything there's always an history, and there's always someone that's pioneered or someone that brought about any intervention or a group of people. And the PCS was developed in the late 1980s, quite a long time ago, by Laurie Frost and Andy Bondi. And it started with focusing on teaching communication through pictures, basically communication for people who are nonverbal or people who have a sort of communication issues. And these pioneers, Laurie Frost and Andy Bondi, saw these as a sort of effective way for several individuals with autism to express themselves. So they just felt that, okay, is there something, is there an innovation, is there a sort of intervention that we could create to enable or make people that have limited speech capabilities to be able to interact with others, to also be able to express themselves, and to also be able to communicate. So that is why they came up with the PCS, which is the Picture Exchange Communication System. And from this description, the PCS, it's just an exchange of pictures to communicate. So rather than speaking as we do, speaking vocally or making sure our voices are heard, there's a sort of picture exchange for people with limited speech capabilities to communicate with each other. To the next point for this talk, I would like to talk about why PCS works for children with ASD. It's commonly known that children with ASD often experience challenges in verbal communication, their social interaction with people, and also in their understanding of abstract language. And one good thing about the PCS is that the PCS capitalizes on this, and it centers on visual strength, which is commonly seen in children with autism, by basically using pictures as the primary mode of communication, as I explained earlier. So the PCS provides an alternative way for these children to express their needs, their wants, their thoughts, which also can significantly reduce frustration and improve overall behavior. Because for children with ASD, if they find it difficult to communicate, that is when they start to throw tantrums, or they, in a way, try to express their frustration. So with the introduction of the PECS, it could significantly reduce this. Moving on to the next point, it's the key reasons PECS works well for children with ASD. So first, visual learning. Children with ASD, they often process visual information more better than auditory information. So basically this is they process what they see better compared to what they hear. And of course, PECS uses pictures which is a concrete and straightforward method to make communication more easier to understand. Another reason why PECS works well is it emphasizes on non-verbal communication. So PECS doesn't rely on speech, as I've always been saying, or as I've said earlier. And of course, children who are non-verbal or minimally verbal can also communicate verbally, effectively rather, using pictures. The third point of why PECS also works well is PECS follows a structured approach. So the approach is organized, and this approach consists of 6 phases that guides children from picture exchanges to more complex sentence structure and spontaneous communication. I'll explain this in details. So the 6 phases of the PECS is implemented in 6 sequential phases. What do I mean by sequential? That is, one precedes the other and one succeeds the other. So in the phase 1, the child basically learns how to exchange a picture of a desired item with a communication partner to receive the item. So for example, there's like a list of pictures or some pictures placed either on a table or wherever the child can easily reach. So the child wants that item. So since the child is non-verbal, in order to express or to communicate that he wants this item, the child basically just picks a picture of that item and show it to the communication exchange partner, which can either be the parents, the caregiver, or the siblings. In phase 2, PECS in a way encourages distance and persistence. What do I mean by this? The child basically learns to seek out the communication partner and travel to them to make the exchange, ensuring that they can initiate communication independently, even when the partner is not in immediate proximity. So what do I mean by this point? Let's say, for instance, the child is in the living room and the communication partner, which I said could be the parents, could be the caregiver, or could be the siblings, is in a different room. So basically, the child can easily reach out for the picture of the item the child desires or wants, then go to wherever the communication partner is and show the communication partner that, okay, this is the item I want. So basically, this creates a sort of independence for the child, and it also encourages distance. So basically, the child will make sure that he looks for the communication partner because he wants to express his wants, he wants to express his needs, he wants to express his desires to the communication partner through the aid of pictures. Then, going to the third phase, PECS in a way encourages picture discrimination. The child is taught to choose from multiple pictures to request specific items. And this phase also introduces the concept of making choices, which enhances the child's ability to communicate more specific needs and desires. So what do I mean by this? In a way, for instance, there are several pictures that are placed on the table. Of course, the child makes a choice to the exact item that he needs at that specific time. So this encourages choice. It also encourages decision making of the child. The fourth phase is sentence structure. In this phase, the child learns to construct simple sentences using a sentence strip. For instance, they might place a picture on the strip that says I want, followed by the picture of the desired item. So maybe there's a picture and the picture says I want, or the picture as a sort of conceptual representation of showing or expressing the verb to want. So basically, the child places the picture strip, or it could be a strip where I want, the word I, then wants are written on that picture strip. Then basically, the child picks the picture of the desired item and places it beside this sentence strip in order to express his need or desires. And we can see that in a way, this also sort of encourages the construction of simple sentences. The fifth phase, which is basically still under the key reasons of why PECS is thought to be effective in children with ASD, is that the child is taught how to answer questions. So basically, the child is able to answer simple questions like, what do you want? And how does the child does this? The child basically constructs sentences using the picture system, and this encourages rather more natural conversational exchanges. So what do I mean by this? The conversational partner could ask the child, what do you want? And basically the child makes a choice based on the several pictures that are placed on the table, placed wherever he's able to reach. So in a way, even though it's non-verbal, a child has been able to construct a sentence or answer a question. The final phase, commenting. PCS encourages commenting. So in the final phase, the child learns to make comments about the environment or objects without being prompted to make requests. So for instance, they might say, I see or I hear, using pictures. So like I said, the mother might ask, or the communication partner might ask, what do you see? And if there's a picture that conceptualizes, I see, the child can easily pick that, or I hear. The child knows, okay, probably a picture of the hair, an image of the hair. The child could easily pick it and say, okay, this is I hear, or this is I can see. Moving to the final reason of why PECS works well for children with ASD is it encourages social interaction. So like I've been saying and like I said earlier, in a way it fosters a sort of natural communication exchange between children with ASD and their communication partner. Moving on to another point, which is the benefit of PECS for children with ASD. It improves communication. It provides a clear and tangible way for children with ASD to communicate, reducing frustration caused by their inability to express their needs. The second benefit is it enhances social skills. Since PCS involves interacting with a communication partner, it basically promotes the development of social communication skills and assists these kids to be able to engage effectively with others, not only their communication partner, but also in a social setting. It also reduces problem behavior. So by giving children with ASD a functional way to communicate, it could reduce problematic behaviors like tantrums or aggression that may of course arise from communication difficulties. The final benefit is it promotes independence. So basically the child is able to use a pictorial representation to communicate without needing someone to do this communication for them. So it allows the child learn to initiate communication without prompts, thereby fostering a sense of independence. Moving on to the final points, challenges and considerations of PECS. So while PECS is highly effective for several children with ASD, it may not work for everyone. Some children, why? Because some children may struggle with transitioning from pictures to spoken languages, and others may have difficulty grasping the concept of picture exchange. But one good thing is consistent use, reinforcement, positive reinforcement, along with collaboration with therapists, educators, and patients and parents rather, are important for success. And additionally, while PCS helps children communicate through pictures, it is not intended to prevent the development of speech, but rather to serve as a bridge for those who struggle with verbal expression. In conclusion, the PCS has been shown and has been proven to be a valuable tool for enhancing communication skills in children with autism. Its visual structured approach aligns with the learning strength of several individuals with autism, enabling them to communicate effectively, develop social skills, and gain independence. So by implementing the picture exchange communication system, parents, teachers, and therapists can provide children with ASD with a functional and meaningful way to connect with the world around them. So that's all for today's session. Thank you for listening. And if you have questions, I'll be willing to answer them. See you next time. Thank you.